Professor Helen Berry, thank you for speaking to me today. It's really good to have you here with us because actually you've been doing some really important work on the issue of mental health and climate change. And maybe it'd be best to begin by just finding out what your job is and where you work.
Thanks, Daniel. It's fantastic to be here today. So I'm a psychiatric epidemiologist and I have two jobs at the moment at the University of Canberra in Australia. One is as the Associate Dean of Research, where my job is to build research capacity in the Faculty of Health. And the other is leading my own research program, which is called People and Place.
Right. And that's quite a wide research field, actually, looking at people and place, but part of that work is looking at the specific effects of climate change on psychological distress and mental health. And it'd be really good to hear about some of the work that you've been doing. You've been looking at the effects following things like drought and cyclones and temperature change. Could you just give us a little walk through some of that work you've been doing in that area?
Sure, yes. And in fact, it sounds like a bit of an abstruse link, but it isn't. So our research is all about what makes a great life for people. And no matter what kind of person you are, no matter what your background, who you are, where you've come from, and no matter where you live, whether you live in a remote area, in a big city, whether you're rich or poor, and so on. And the social environment, of course, is enormously important to our mental health and well-being. And so also is the physical environment, and this has been very under-researched. And I became interested in climate change because it's such an enormous contributor to the physical environment in which we live. And as I started to think about it more, I started to realise that we've got a really huge problem on our hands and we need to start thinking about it right now. So, and of course, because nobody had been thinking about it, there had been no research into it and no theories, no ideas, no frameworks. So we've, in my research group, been beginning some early work in that area to contribute to now work that's also being done elsewhere in the world. And we're looking very much at population mental health effects of climate change. And essentially as the globe warms, the climate changes. Partly it becomes warmer, of course, but mainly the weather becomes much more variable on every continent in the world. And this means that we get far more extremes. We still get some extremes of cold weather and the kinds of weather events you associate with cold weather, like lots of snow. But mostly we get extremes at the other end of droughts and cyclones and floods, and especially, of course, heat waves on hot days. And there has been a study into these phenomena and their impacts on mental health in the past, but nobody's done big population health surveys to establish what the population impacts of these are on mental health. And we've started to do that. So, for example, we completed some work on drought recently, which identified that there are actually 5 different types of dry weather that you could be exposed to. And only one of those was associated with population mental health impacts. And that was a situation in which there'd been drought going on for many years, grinding away in the background, if you like, finishing up with a year or two of catastrophic drought where there would be no rain for probably 14 months or more during that 2-year period, maybe longer. And people facing that kind of drought, generally speaking, had mental health impacts, some very severe.
There's an interesting differential between urban dwellers and rural dwellers.
That's exactly right, Daniel, there was. And in fact, when we first looked at the data, we didn't find any impacts of drought, which really surprised us because we knew about suicides and so on. And when we split our sample into people who lived in rural and remote areas and people who lived in urban areas, we found, as you say, it was only those living in rural and remote areas who were affected in that way. And in fact, there was a slight trend in the other direction for those living in urban areas. So their mental health, if anything, was a little bit better in that kind of extreme drought. And we think that this is a very good illustration of how much it matters who you are and where you live. So exactly the same climate and weather exposure, resulted in such a dramatically different impact depending on whether you lived in rural Australia or a city. And of course in rural Australia, protracted drought and catastrophic drought means the loss of your farm, the loss of your business, the loss possibly of your household, a lot of loss and suffering and pain. Whereas in the city it means the weather's great every day, you can have a drink after work outside every evening, it's really nice, and so your experience of the drought is really very different from someone living a few hundred kilometres away in a rural area.
And the other interesting thing about that study was the comparisons you made between disadvantaged groups and against the rest, with showing that the disadvantaged actually felt the effects of drought more. Can you tell us a bit about your thoughts around that?
Well, we expect that climate change is a multiplier of risk and disadvantage. So we're not expecting to see the emergence of new psychiatric disorders as a result of climate change, but more likely the development and progression and earlier development and worsening of psychiatric disorders and the prevalence of such disorders. So we expect that those who are already vulnerable for some reason, because they have an existing diagnosis or because they're physically ill or they live somewhere very poor or they're very poor or any number of things that make people vulnerable, we expect that that will make them at higher risk, that the impacts will be harder on them and harder to recover from. And we are finding this. For example, we did a study with the Queensland Health Department. Queensland's the northeastern state in Australia. It's a bit over 13 times the size of England. It was affected by very severe cyclones and flooding in the summer of 2010 to 2011. And we did a study of trauma impact across Queensland for that period. And what we found was that people who had experienced significant damage to their homes and workplaces and businesses and neighbourhoods and the homes of significant others did show trauma responses, particularly where they experienced damage to multiple locations. People living in poor areas or in rural and remote areas were much more likely to be affected by the floods and cyclones in the first place because of where they lived. And then if they were affected, 2 to 3 times more likely to develop a traumatic response. And this is typical of what we expect, that the population mental health impacts of these weather disasters are generalised, but they're much worse for those who are already vulnerable for some reason.
And so what you're actually demonstrating here is that the extreme weather events that are happening, and really in Australia is a good example of that because you have such extremes of temperature generally anyway, the nature of the country, you're linking these with population-based effects on mental health and psychological distress. And when you look at the climate change data, what thoughts does it make you have about the increasing trends of these weather extremes?
It really worries me. People tend to think, in my experience, that a degree or 2 of global warming doesn't really matter much, and if you live somewhere like England, then it's probably quite welcome. But it doesn't work like that. What it does is makes weather much more unstable. So you get far more extremes. You don't get a nice even 1 or 2 degree rise. You get violent extremes, more frequent and worse storms. And of course you've experienced severe flooding and hot summers and a winter that wasn't cool enough to kill off all the bugs and so on.
Yes.
And it's more that kind of effect that you get. And in my own country, in Australia, where I live, in Darwin, which is the capital city of the Northern Territory, our northernmost state, at the moment about 11 degrees a year are over 35 degrees in Darwin, which is very hot there because it's an extremely humid place. With a couple of degrees of warming, that number goes up to 227. It's a phenomenal leap in extremes, and people don't realise that global warming does that. And so I think we have a really serious problem. Our recent research on heat, for example, again, we're looking at population health, so we're not focusing in on people in hospitals or people with existing psychiatric disorders and so on. We're looking at the whole population. And what we're finding is the effects of hot days can affect people's psychological health and mental health for up to a year in the case of men, and for 3 months or so in the case of women. And we also find differential effects. So heat waves, for example, affect women's capacity to undertake their emotional roles in life, whereas they affect men's sense of vitality and powerfulness and being big and strong and capable. And so we're finding that that all these different kinds of weather events have different kinds of mental health impacts that vary by the type of weather event and where people live and what sex they are and what age they are and their personal circumstances, such as their poverty or their education level and so on. So when modelling what climate change may do to mental health, we have a very complex and difficult situation to deal with because there are so many nuances in it and so much uncertainty around the science of psychiatric epidemiology, of course, and of course climate science itself. So very difficult to work out what to do and what messages to send and how best to approach it.
Yes, you wrote an interesting paper trying to model the potential mental health effects from climate change, and you mentioned that the mental health effects often come at the end of a long and complex causal chain of events. And I guess when you sit that within the complexity of climate science and the difficulties you have in getting the message across to all these different groups, it can become quite a difficult job to sort of engage people with the importance of this message. And what your evidence suggests is that there are these links between changes to the weather and people's mental health. And I guess the point I'm getting at is, have you tried to engage people politically, in the media, corporations, academics? What are the positives or the challenges that you've faced in trying to engage these different groups?
It's a very good question, and engagement is extremely important. And of course, as a scientist, that's not what we're trained to do, and so it's been quite a learning curve. We engage routinely with all those groups you mentioned. We work a lot with the media. We get to know journalists. We background them a lot. We try and make sure there's public information available. It's hard to do without scaring people, and creating a national panic is not what we're trying to do at all. What we want people to do is to understand the world is changing, that there are things that communities and governments and individuals and organisations can do, both to adapt to the change and plan ahead, and also to help mitigate so that we reduce the amount of change we create into the future. And we do work with all of those groups. As much as possible, we involve industry and non-government organisations and government in the design of our research. We engage them in helping frame problems and questions to be answered. We talk to them frequently about early results long before they're published, to give them an idea of the direction of our thinking and what we believe may happen. And I think it's important to keep that going. I think it's very important not just to have the occasional media splash when you've published a big paper, but to have a continuous conversation that's embedded in real relationships that are intended to endure.
That's really helpful to hear that. Do you think there's not enough evidence really to start talking about how climate change might affect the prevalence or presentation of mental health disorder? But I think as a psychiatrist I'm really interested in that, and I'd be interested to hear your thoughts on perhaps how mental health services might need to adapt into the future.
I think that's a huge area. One of the things that we need to be aware of is that the expected prevalence rates are going to go way beyond what we can handle in current clinical models. So calls for more psychiatrists, more mental health nurses, more counsellors and so on are all very well, and they will be needed. but they're not going to be close to able to meet the need. And we have to look at different solutions. I think a couple of key strategies that we need to bear in mind. One is that we can look for a greener way to do psychiatry, and I know your own fellowship is very much focused on that. If we can think about ways to reduce our own carbon footprint within health services, we would be making an enormous contribution to mitigation as well as adaptation, because of course, as you know, we're a huge contributor to the carbon footprint in our respective countries. And it's possible that we may end up doing psychiatry better that way as well. So if you imagine taking services out to people rather than getting them to come into us, perhaps taking services into group settings more often rather than primarily in one-on-one settings, looking at social prescribing more so than pharmacological solutions as the sole or principal route of treatment, and so on, we might actually deliver better services and get better outcomes. People's mental health is very much embedded in their community context, and if we're working more with those, we may do a better job as psychiatrists and mental health practitioners. And I'm certainly directing the efforts of the research program in that direction. And I think that communities are going to have to play a really important role in mitigation and adaptation, as well as in handling the day-to-day aspects of mental health presentations and management. And so, and indeed, climate change might well be a bit of a trigger for communities coming together and working harder to support each other, which could be a pearl in the oyster.
Well, thank you for speaking to us today, Helen. It's good to end on that positive note. There might be a silver lining or a pearl in the oyster, as you say, through community collaboration with the threat of climate change, or the effects that climate change might have on communities, particularly perhaps disadvantaged or rural communities. So thank you for speaking to us today, and thank you for your valuable work, actually. So thanks.
Great pleasure, thank you.